Hello and welcome to today's call. A kind reminder that all lines have been muted except for our speakers. To ensure the stream quality, all viewers' cameras will be shut off for the meeting. Today's call is being recorded. To start our call, I would like to welcome Julio Figueroa with AT&T. Julio is the chair of the Greater Coachella Valley Chamber of Commerce Legislative Advocacy Committee. Julio?
Thank you, Brandon. Good morning, everyone. And on behalf of the Greater Coachella Valley Chamber of Commerce, I would like to welcome all who have joined us on today's call. The Chamber is proud to host these calls for the benefit of our business members and community, helping to connect elected officials to their constituents. The Chamber would like to quickly thank our legislative event sponsors that make these calls possible. AT&T, Supervisor V. Manuel Perez, Pueblo Viejo Restaurant, Desert Urgent Care, Greater Palm Springs CDB, City of Indian Wells, Tech Waste and Recycling, Fantasy Springs Resort Casino, Desert Care Network, Altura Credit Union, Mechanics Bank, and Andy Group USA. Today's featured speaker is Congressman Raul Ruiz, MD. Congressman Reese represents California's 36th Congressional District, which includes the entire Coachella Valley, as well as the cities of Banning, Beaumont, Blythe, Hemet, and San Jacinto. He resides in Palm Desert, California. Dr. Reese grew up in the community of Coachella, where both of his parents were farm workers. He graduated from Coachella Valley High School and magna cum laude from UCLA. He went on to Harvard University, where he earned his medical degree, as well as a Master's of Public Policy from the Kennedy School of Government and a Master's of Public Health from the School of Public Health, becoming the first Latino to earn 3 graduate degrees from Harvard University. Dr. Reese worked as an emergency room doctor until he was elected to the U.S. House of Representatives in 2002. Dr. Reese is currently serving his 4th term in the United States House of Representatives, where he serves on the Energy and Commerce Committee. Congressman Reese, at the end of this meeting, if you have some time, we'll do an A clap for UCLA. We're just kidding. Thank you for joining us today, and the floor is all yours.
Thank you, Julio. Thank you, Josh, for the invitation, for that introduction. It's always a pleasure to be here with all of you. This has been a tradition now. I think I've been speaking in front of the chambers since I've been elected. And so it's always a good opportunity to talk about what we're doing and what are some of the updates, and also to listen to the concerns and the needs of constituents and small businesses in particular. So I want to thank everybody for being in this legislative forum, and thank you for all the work you do on behalf of small businesses. I truly believe that small businesses are the backbone of our economy. Small businesses help fuel our commerce. They produce the majority of jobs that are available, and so we need to pay particular attention to small businesses as compared to large corporations, who oftentimes have had the advantage over many of the policies and assistance that our government has given. So you know that before I ran for Congress, I practiced as a board certified emergency physician here in the Coachella Valley, and also at Harvard in Boston. I have a specialization from Harvard in public health, precisely on humanitarian and disaster aid, and have focused my attention a lot on health disparities and the issue of the social determinants of health that has been a mission of mine since the very beginning. And this being in office is an extension of that mission in order to fulfill that purpose. So having worked in the emergency department during the H1N1 pandemic, having training in disaster response, and basically it is through that lens that I speak to you today. It is through the lens of a public health expert who understands the data, knows the data, and has insights not only through the information from our experts in our country, but also through the medical literature, the science that is being produced at a rapid rate during this pandemic. And where are we now in this pandemic? Over 160,000 Americans are dead in about 7 months. Over 5 million are infected. Tens of millions are out of work, and millions are have been hospitalized, and many have suffered morbidity that has required a long recuperation from an illness, and have also led to some permanent scarring. So we've seen hospitals in Riverside County and throughout our nation that have been overwhelmed. We know businesses have closed and cities forced to cut essential services and workers as they lose revenue. These are not joyful times, but these are times of opportunity. These are definitely times, unprecedented times, that call for unprecedented responses. And in Congress, we've taken action to help constituents across the nation, and in particular here at home. So I'm going to do a little run through of some of these bills. In March, we passed 3 pieces of legislation to respond to the unfolding public health and economic crisis. First, we passed H.R. 6074, the Coronavirus Preparedness and Response Supplemental Appropriations Act. I had the honor of presiding over that vote as a speaker pro tem. I believe that during that time, my background and my expertise came in handy in advising the House leadership. I was oftentimes chosen as maybe one of 4 members of the Democratic caucus to ask questions of Vice Prince, Secretary Azar, and the other White House task forces. After that bill was passed, we passed H.R. 6201, Families First Coronavirus Response Act. Those 2 bills really focused on the public health approach, in ensuring that there were monies to help the hospitals, testing, and the other needs to really hold the line. After that, we passed the CARES Act, H.R. 748, in March as well. These were all passed swiftly by both chambers on a bipartisan basis, and the president signed them into law shortly thereafter. The CARES Act provided hundreds of billions in Paycheck Protection Program funds for small businesses around the country, as well as Small Business Administration disaster impact loans that were included in the aid package. In April, Congress also passed the Paycheck Protection Program and Healthcare Enhancement Act to provide additional funding for small businesses, hospitals, providers, and increased testing to combat the coronavirus pandemic. So that's the last relief bill that's reached the president's desk, even though in May, the House passed H.R. 6800, the HEROES Act. It was very prudent that back then we pretty much knew that the pandemic was going to continue, that there was going to continue to be economic hardships, that there was going to be a cliff of the unemployment help, the mortgage assistance, the rental assistance was going to be there. The science was telling us that the pandemic was going to continue throughout the summer, and that we were going to still see hardship. So the House prepared for that, and the HEROES Act was appropriately named in honor of our heroes, our healthcare workers, and also our first responders, our teachers, our transit workers, our food suppliers, and others whose essential jobs keep America going while putting them at greater risk of infection. In addition to the extended unemployment benefits and another round of stimulus checks, the HEROES Act would help small businesses in our valley by amending the Paycheck Protection Program to ensure that smaller businesses and nonprofits are not left out in the cold by doing several things. It establishes an additional set aside of funds specifically for small community development financial institutions, CDFIs, as well as minority development institutions, MDIs, small business administration micro lenders, and SBA certified development companies. What we saw initially from the first round of PPPs were that the larger, more well-established small businesses that already had relationship with these larger banks who administered the program were first in line to get the loans. So those are the ones that could afford the expensive lawyers, that had their previous capital from those specific banks. So that money ran out quickly. And many of the smaller businesses, those with less than 10 employees, those that are veteran-owned, women-owned, minority-owned, those in rural areas like here, were left in the cold, and they didn't have enough to go around. So the Supplemental CARES Act had funds for them, and the HEROES Act has specific carve-outs and specific mandates, like 25% of the funds to be used specifically for small businesses with 10 or fewer employees to guarantee they are fully able to access PPP assistance. And also creating a carve-out of 25% of the funds solely for the use of all nonprofits, no matter their size or type, but requiring that at least half this amount go to small nonprofits under the 500 employee threshold. Many of the funds that the county received from the CARES Act are going towards smaller businesses. So there's a different route that the funds are being used. The HEROES Act is currently held up in the Senate, and as negotiations continue, I'm advocating for an urgent solution to bring relief for struggling families, workers, and businesses in our district. That is why I have also co-sponsored the local chamber tourism and 501c6 Protection Act to give local chambers of Congress eligibility for the Paycheck Protection Program. I know that many of you who participate in small business chambers of commerce were very interested in that bill. This legislation is essential for chambers, as chambers will play an essential role in helping small businesses get back on their feet. And as we watch cases continue to soar and jobs continue to disappear, it is clear time is of the essence. And so I urge Senator McConnell to bring the HEROES Act as a part of a framework in the conversations. Now, of course, the House leadership is in negotiation with the administration, and the Senate is pretty much taking a back seat during those negotiations, because politically, Senator McConnell will basically do whatever the president wants him to do. And so he's waiting for the solution so that he can then bring it up into the Senate. But quite honestly, I'm very frustrated in knowing that in political crisis situations, or in this situation, the procrastination, the delay, the wait that has occurred has created another political crisis for working poor or unemployed families. And that crisis is being used as leverage during the negotiation. All of this didn't have to be this way, and it could have easily been prevented if they would have started negotiating from the HEROES Act early on. So thanks for having me on today, and I am so willing to answer questions. Josh.
Thank you, Congressman, for the update. For those of you who may not know me, my name is Joshua Bonner. I'm the president of the chamber, and I'll be moderating the Q&A for today's call. If anyone has a question they would like to ask the Congressman, they may type it into the chat room to the moderator. Please be sure to include your name and email address when submitting a question. The Congressman will answer as many questions as time allows for. I do want to let everyone know that our call has a very firm end time of 12 p.m. today. Out of respect for the Congressman's time, we know that he's very busy. Before we get to the questions too, I just wanted to add one thing real quickly to what the Congressman said. His staff has been very good about communicating with the chamber throughout this entire process. Congressman Ruiz has actually taken the time to personally call me during the process. So I know that those communications don't get the publicity that these big town halls get, But I did want to let the community know that he's done a great job and his staff has done a great job with communicating with the chamber and our members throughout this whole process. Congressman, we'll go ahead and get right to the questions in no particular order because we had a bunch that were submitted. I'm going to jump right to this one because it dovetails into what you were saying. Are you hopeful that we will get another phase of economic relief through Congress this year?
Yes, I am hopeful. You know, initially, there seems to be a pattern that we're seeing where, you know, the House is willing to act and act quickly. The Senate refuses support. We've heard from the Senate, Senator McConnell, that no further aid was coming. We know that about 20 Republican senators will vote against any further aid to the American families. But our democracy is still alive and beautiful. And when the American people speak up, when their voices are heard and the pressure gets heard, then there's more pressure for people in office to act according to the intensity of what the people want. And so we've seen them move from, at the very beginning, wanting only $500 billion for large corporations to the CARES Act. We've seen them say absolutely no more funding after the CARES Act to now having negotiations. So I am hopeful the progress is being made. I don't think the executive orders are the end all. In fact, they complicate a lot of the policies and they're working out the workability and the constitutionality of these executive orders. So they're not necessarily the end all solution if even they get to be able to be implemented. So we absolutely need a more concrete congressional solution to get assistance to the families, to put money in our unemployed's pockets in order to continue to have the working poor or the middle class family who are now finding themselves in dire straits to have purchasing power in order to pay their bills, their rent, their utilities, and the other necessities they need for their families during these troubling times.
And just to follow up to that, I know that we saw that President Trump had attempted to issue some help around that, but maybe you could speak quickly to why it's important that ultimately come from Congress.
Well, I mean, you know, the executive orders is very, very short-lived. They're not very concrete. They have no financial backing. That's one of the problems, is that, you know, he can say that they'll provide a certain amount of assistance with unemployment and the states will do it. But if there's no financial backing for that, then it's not workable. So Congress holds the power of the purse. They authorize, they allocate, and so the president can write executive orders, but without the long-term solution, concrete direction from Congress or the power of the purse, and those are very short-lived and will be nothing more than smoke screens during a campaign time.
COVID-19 has in many ways laid bare both the strengths of our national medical system, research and development, well-trained and dedicated medical professionals, and some of the weaknesses, underserved communities, ER capacities, etc. How do you rate the state of healthcare both nationally and in the Coachella Valley? Obviously, this is something that you do speak from a position of authority on, so interested in your take on that.
So Josh, you know, this is a message that I'm giving policymakers in DC, having studied this issue, lived it myself, having grown up in a farm worker trailer park community initially, and then of course in the streets of Coachella, and having worked in the agricultural business myself in the packing house out in Thermal, California, here in our district, where I learned very early on that every system has an end product, right? You look at the agricultural food supply chain and you realize that the end product are very good, appealing citrus or watermelon or bell peppers that get to the person's home, and you cook and you eat that food that nourishes our body. That's the end product. So we have to look at our healthcare system in light of what the product of our healthcare system is. And nobody's talking about this. Everybody's talking about our healthcare system in terms of who's going to pay for a very expensive healthcare apparatus that produces a very poorly a population that fares poorly in their health. So the end product of a healthcare system is the health of a population. And so in looking at that lens, you realize that the state of our healthcare is not very good because we don't have a healthy, productive population compared to other industrial nations that have the same amount of resources that we have in order to focus on the health of our population. And this pandemic has brought that to bear. And what this pandemic has brought to light is that we have higher rates of diabetes, of asthma, of obesity, of here in the Coachella Valley than in the whole of Riverside County and all of the state, and higher than the national average as well. And so when you look at America, in America's population, you see that we have poor health indices compared to other industrialized countries. This pandemic causes a higher severity of illness in people with poor health. And so it's no wonder that the health of our community is one of many factors as to why we're being ravaged by this virus in Riverside County, in Coachella Valley in particular, in the entire state, because the county has one of the worst health indices, our population, compared to the rest of the state as well. The other aspect is that we have disparities. In other words, not only do we have a general unhealthy population, but in certain pockets of our communities, in certain regions, in certain communities, you're having healthcare access problems. So for those of us who have been working in healthcare, it's not a surprise why poor communities or working poor communities or farm worker communities or the East Valley is being devastated right now by this coronavirus. So it's almost like frustrating to hear political leaders have an aha moment, or where you see that light bulb comes up when this has been talked about for so many years and being focused on. The other thing that this healthcare notion or healthcare system has brought to bear through the pandemic is that our personal health is related to the health of others in our community. So we cannot live a healthy life and protect our communities if you have a neighboring community that is deficient in healthcare access, in healthcare resources, or if we neglect to provide the protection of health that they need to keep their communities and their families safe, then we are only neglecting our own health. So if we do not take care of the most vulnerable amongst us, if we do not strategically target our assistance to ensure that those that are most at risk of getting infected or most at risk of dying from this, then we're doing a disservice to all of the communities, including our businesses, our economy. So that's the approach I take. I think that we need a lot of work to do. Yes, we are experts at creating very expensive medical tools to treat very, very difficult illnesses. And we're really good at expensive care in the ICU when people get really, really sick to keep them alive. But what we're not good at are the fundamentals, of keeping healthy or moderately healthy people healthy, or preventing illnesses, or ensuring that we focus on mental health, spiritual and physical health to allow the human to develop into its full potential. And so that if we focus on those parameters, taking into account our lessons learned through this pandemic, then we will help increase and improve the health of everybody, the the mental health of everybody, and therefore expense will go down, longevity and all the health wellness measurements will go up, and you will see a much different country talking about a much different approach of healthcare policy. And so I have a plan, I have a vision for our nation for the next 10, 20 years. I've got the ear of our leadership, and I'm working on that plan currently.
Yeah, we locally tend to see it through our own lenses, and we live in a fairly populated area of the country, obviously being in Southern California, but these are issues that extend across rural America. Access to care, it certainly is a national issue. It sounds like you're talking about.
It is a national issue. However, some areas are worse off than others. And you know, since I've been a college student, medical school, I've always been in touch with the healthcare in Coachella Valley and Riverside County. And if you just compare the health indices of the Riverside County compared to all the other counties in the state of California, then you'll realize that we're at the bottom third, not only in the health of our own population, but also in terms of the healthcare resources that our communities have access to. And so that is a serious problem of disparity here and you see it played out in this pandemic. It is no wonder why Riverside County, amongst many other issues, is the second worst in terms of this pandemic in the state of California. Even though we're the fourth largest, it's no wonder that even within the Riverside County, the Coachella Valley is principally at highest risk due to our health disparities, our lack of healthcare access, our essential workforce in agricultural communities, in terms of very significant systemic decisions, erroneous decisions, and ill-equipped containment apparatus. And so, you know, it's no wonder why we're seeing what we're seeing here in the Coachella Valley.
So this next question is one that I hear quite a bit. In order for small businesses to safely return, many feel some form of a safety net must be provided relative to COVID-19 liability. Do you support liability protections for small businesses that have taken reasonable precautions to protect people from the COVID-19 threat?
Well, I think the caveat there is precautions, that have taken precautions, because we need to incentivize all sectors of our society, public, private, nonprofit, all the sectors, to move towards following the scientific proven public health precautions to reduce the spread of this virus. We have seen very good practices. The city of Palm Springs has really led the way, I would say, perhaps in the entire county, and yet you have other cities who have been lagging behind. You have some businesses who do an incredible job of sanitizing their location, of ensuring everybody is following the rules, but yet you see some businesses who purposefully have mocked the public health precautions, and almost as a statement of political rebellion, has opened their doors without the consent of the public health strategic plan, and have put their employees and their customers in jeopardy. And we have seen large outbreaks in packing houses, meat packing houses in particular, in the Midwest, where you have businesses who force people to come in, who don't accommodate for those at highest risk, who don't provide PPEs, who do not provide a system where they can stay 6 feet apart, and they're being forced, they're putting their employees in jeopardy, increasing the risk, and you're seeing an outbreak. And that outbreak then extends into their homes, it extends into their community. So do I want to protect them from their, with liability protections, so they can dismiss the importance of keeping their employees and the communities in which they function safe? No, I don't, because we need to incentivize and enforce these precautions in a way that will help the worker and help clients stay safe. Do I want to incentivize businesses to follow these precautions? Absolutely. So if we can find a way where we can look at the criterias of safety, and then if they follow all the best practices that exist within their associations, within their county, their states, and the national public health associations, then yes, then I do believe in some liability protections. I'll give you an example. You know, there are concerns by OBGYN physicians that because they had a shutdown, or because the ultrasound labs had to shut down, that the patient's care was delayed. There's concern that that delay might have changed what parents would have done, families would have done, or decisions being made, and therefore, through no fault of their own, OBGYNs will be held liable for no fault of their own. So that's different than when somebody has the ability to make the changes in order to provide the precautions. So it's a more nuanced answer than I think that that people might want to hear. But of course, you know, it's all a health risk assessment. I think that businesses, responsible business owners, and supervisors that are out there that I've seen are doing a great job, and they should be incentivized in order to continue with those precautions to keep their employees, their workers, and their customers and their community safe.
Okay, let's pivot here to another one that I think is going to be a growing concern, and it's just going to continue to get larger. There is a looming crisis when it comes to rent and mortgage payment deferments that has been essentially kicked down the road with local and state moratoriums on evictions. But the reality is, whether it is the consumer, the property owner, or the bank, at some point the bill is going to come due. What are your thoughts on where we stand with rent mortgage moratoriums, and what will be the long-term solution?
Well, the moratoriums, and not only from the federal government through the federally backed loans, mortgages, and assistance, as well as the state and even some of our local cities that have had the courage to put these in place, have prevented many from becoming homeless. So there was some good in that, and allowed those that truly were struggling in dire straits to use their money in making sure their medicines are paid for, personal safety and health, and some of their other utilities. Now, those protections have expired, and so we need to do something quickly. The CARES Act provided funding to states, and then via states to counties, or to counties, to help with that. There's a lot of monies that are being spent from the county on rental assistance with other nonprofits that were made available through the federal funds currently. But the approach moving forward is that I agree with is the approach that we devised on paper through the HEROES Act. It provides $75 billion, for example, in assistance to homeowners struggling to afford housing costs due directly or indirectly from the impacts of the pandemic. It also provides more emergency rental assistance with $100 billion more for emergency rental assistance programs. And it also has $309 million in supplemental funding for the USDA's rental assistance programs to help renters in rural areas. So the question, and this was discussed very early on when folks called me about evictions, moratoriums, was, you know, there will be a time where the bill is going to be due. You either, one, could help with the assistance to individuals to pay that bill. One, the other approach is to create a payment plan afterwards to help the individual based on certain elements, like whether they're unemployed still, whether they have a job, to get them back on track that will help them not be confronted with a large bill at the end of the moratorium. In addition, the landowners should also have that assistance to give them a cushion because they also have bills that they need to pay as well for their own properties and their own businesses.
Yeah, kind of a follow-up to that question, because it all is part and parcel of the same issue. Unemployment has been a big topic of discussion right now. Additional unemployment benefits. We've heard $200 thrown out, $400. It was $600. Your thoughts on where unemployment benefits ultimately need to land, for what period of time? What are you seeing there?
Well, I support the HEROES Act provisions that extend 600, the current support for unemployment, 600 a week until January or first quarter of next year. This virus isn't going to go away. It's going to continue. Economists have asserted that the extra money in people's pockets have helped the economy. Removing that money is going to, in addition, without the jobs available, hurt the economy even further. There are no evidence to show that individuals who are accepting this $600 are not going back to work. Furthermore, if they do, then there are some provisions where they can lose their unemployment. So there's some nuances within that, but those who are offered and have the ability to work and turn it down have to communicate with the EDD to determine why they're turning it down, what kind of hardships that they have. So the system doesn't incentivize people to refuse work if they're able to work. And so we don't see that evidence playing out. In fact, there's been some large studies from some large academic centers from Yale and Harvard and others that have done these economic studies. So I think I am in favor of keeping 600 a week further. We don't have the jobs that could fill the amount of unemployed individuals right now. These are individuals who are using that money for rent, for their bills, for their groceries, for essential needs, basic needs to keep them, their health, their family health, and able to function in society right now.
Thank you. I like this next question. I think it kind of ties into the things we've been talking about. Public opinion on Washington, D.C. is not great at the moment across the entire political spectrum. You're our congressman. We've elected you to 4 terms. I know you're hoping for a 5th. You're in Washington, D.C. most days, working right at the heart of the storm. For the common person who has just seen all the coverage on TV, what the heck is happening in our nation's capital? Is it just that there's more coverage now than there's ever been, more media, or is it just functioning kind of maybe not as great as it should be? Just curious your opinion on that from the question that was submitted.
Well, look, I share the same sentiments, the frustration that coming together beforehand, knowing that those who believe, the scientists and the public health experts, saying that this virus was going to continue during the summer, that it wasn't a 10-day pandemic, or that the summer wasn't going to kill the virus, or that it's going to magically disappear. Prepared in time to have prudence in order to prevent a political crisis. But this is what we see over and over again. You have gridlock, you have stalemates. Everybody's more interested in headlines than to create solutions. And so we're in this mess where millions of families who are unemployed are now very anxious. Their ability to pay their rent, their medications, or even groceries. So yes, there is some gridlock. However, I can tell you that there are a lot of bipartisan efforts being played out. In fact, many of my bills that have passed the House or that I've introduced, many that have been signed into law, have been bipartisan, especially the ones that I'm working on regarding the burn pits. I've worked on a very strong bipartisan effort to end the practice of surprise medical bills, and also on public health policy in my bills that have been passed through the CARES Act. I had a couple of bills that passed in the CARES Act. One was a bill that is now law that will set up a commission to study our global health insecurity, our vulnerabilities in our reliance in the global supply chain of very essential supplies and medications that are needed during a pandemic. And two, the Good Samaritan law that is now law during this pandemic, where healthcare professionals can go and volunteer at a hotspot without liability. So that has helped the state of California create their California Core Medical Corps volunteer team to go around different areas where they're needed. And as we've seen here in past month, Coachella Valley, the human resources is a very important aspect of our capacity to deal with surges. A lot of people focus on the amount of ventilators or the amount of ICU beds, but there was really no talk about how about our nurses and our doctors and the respiratory technicians. You can have all the ventilators that you want, but if you don't have human beings, respiratory technicians to help manage a patient on a ventilators, then those ventilators will be useless. And people get tired, they get fatigued. You work them too hard, too long, and they'll make mistakes. And so the human element of this pandemic was made very evident recently at our local hospitals, and something that I've been talking about even back in March when Vice President Pence was briefing Congress. I predicted that we would reach a time where, especially in rural areas where the healthcare system doesn't have a large resource of doctors, that are not only will our healthcare professionals need to be quarantined, they're also vulnerable to getting sick, but that there's not enough backup. And so they needed a plan to have a federal response for them to hold the line, is what I said, to fortify that line. Because once you have a crack in our front line with our doctors and our healthcare capacity, that's when you start to see images that we saw at New York City. And so you look at multiple systems to just strengthen the point that I'm making, and you see Imperial County and how they've been overwhelmed. It all depends on a healthcare capacity. They have much limited capacity in terms of their hospitals, their beds, their ICU, their personnel, because they're also a very underserved, under-resourced county in the whole state. And so, you can see devastation in a county with less resources and healthcare workers at a faster rate than you will with the same transmission rate, the same positivity rate in other counties who have a higher capacity of managing the caseload in the hospitals and the clinics.
Yeah, I think for this next question, I think because some of our folks that are on the call may not be aware, COVID-19 continues to be a pretty significant issue within Riverside County. I think Brandon actually has the latest graph from the county that shows the numbers keep continuing to go up. This is an area that you and I have talked about. There's nothing better than going and advocating to your congressman on medical stuff when he's a doctor. You get the better of those conversations. But on business reopenings, there's a thought process within the business community that a lot of these COVID spread is happening in the home, in the neighborhood, community level spread. And perhaps some of the service industries, restaurants should be reopened or shouldn't have been closed at all. Your general thoughts on business closures, where we are, where we need to go. Brandon, you can go and take the graph down. Just your general thoughts on business closures.
So here's the approach. Here's the public health approach, Josh. The public health approach, based on the pathology and pathophysiology in our bodies, but also the pathology and the transmission science of this coronavirus. This coronavirus spreads through air droplets, through contamination of objects that eventually get into our eyes, nose, and mouth, into our mucosa, into the cells inside our body that then start to replicate, and then it travels all over our body. Okay, and it's not just a respiratory illness. You have renal failure. You have it can attack the liver. It also attacks the immune system itself by revving it up, which can cause vasculitis, which can cause heart attacks and strokes, even in young populations, people in their 20s and 30s, because of that vasculitis that exists. So knowing that, how do we prevent it from spreading? Well, you prevent it from spreading by not giving this virus, as it moves into the air from sneezing, coughing, clearing your throat, speaking through air droplets, from having another host, another human being, right? And to make sure that, you know, that human being washes their hands, stays more than 6 feet distance, and to ensure that people wear a mask so they don't emit the air droplets into the air. Now, the risk is, the fundamental risk is you have one person who could be infected near another person who's not infected, and you transmit it. So it's the density of people in contact, and it's the frequency and the time in which they're in contact. So in a society, to slow the spread, you need to spread it out, right? And you need to lessen the frequency of people coming in contact. So you ask yourself, okay, where are people in contact the most? Well, where are they in high density the most? So in those high risk locations, you need to figure out a way to either protect individuals from spreading it to other people, or prevent them from congregating or getting close to one another. So there was no selection of a particular type of business or not, or anything of that form that many conspiracy theorists would like to proclaim. But when you look at where people congregate, you're looking at public events. You're looking at places where there's high density. So there's places of commerce, churches, you know, synagogues, mosques, where people come together very close and give that virus the opportunity to spread. Another place was in people's homes, right? Especially during the holidays, where people want to see their family members. They go, they love each other, they want to give each other a big hug and a kiss without a mask. And so you see where people congregate without the precautions, you increase the risk of moving the virus. The goal, Josh, that we want to get to, okay, and this is very important, because we have to think in these public health ways, because I've always said that there's a right way of opening our economy and a wrong way of opening our economy. The right way will open the economy at the right time, when you have control of this virus, when there is a significant drop, when you're at a significant manageable level of prevalence of the virus in the community, and also when you have all the appropriate safeguards in place. That means that before you remove stay-at-home precautions, you should have a sufficient number of contact tracers. You should have not only a well-defined objective of testing, and there's no one testing modality or methodology that fits all. You have surveillance testing, you have prevalence testing, you have high-risk targeted testing, and so there's different ways to test in order to get the answers that you want to keep a community safe. The amount of contact tracers is also very key, but the end goal of this is to create an apparatus where you can quickly, efficiently identify people that are that test positive and separate through distance and all the precautions that person, all the high risk who have been around that person, away from either their family if they cannot self isolate at home, or away from the greater community in a way that's humane, right? That provides for their resources and their understanding. California and our county in particular did not have those systems put in place before we removed the stay-at-home precautions. So I'll just give you an example. When those stay-at-home precautions were removed, we had 60 contact tracers when we should have had at a minimum 360. One can argue that we need more contact tracers than other areas than 360 because we have a higher risk demographic of transmission and severity of illness. We don't need to just rely on the county to get those up and running. Different healthcare systems can have it, different nonprofits can have it, and oftentimes we have to move into different, more innovative ways that can meet the needs of the society in which you're functioning. The other issue and the big picture here is not just the number of contact tracers, but the end goal is to help remove the individuals who are sick, provide them the support, the incentives to not get near either family or other communities. That requires locations for people who cannot self-isolate at home. So do we have enough hotel space or shelters where asymptomatic individuals who are infected and contagious can go to protect their family members and their community? You're seeing a high rate of infection booming in the East Valley because oftentimes you have 3 generations living in 2-bedroom apartments, trailers, or low-income housing. And so clearly, we do not have a system that's efficient time-wise with the resources to really contain this virus. And so that's important because the right way of opening has those in place. You open businesses, you test your containment apparatus, you get a hold of this virus, you bring it down, the increase, you start to open more of the economy, you practice the new challenges of having more infection rates to make sure that you're able to test, contain, isolate, and do what you need to. Then you continue to open so that you're matching the frequency of the risk in the density and the frequency of more people going, removing the stay-at-home precautions with your apparatus. Because the end goal is to open our businesses and keep them open. That means that you build trust in our economy, you build resilience in our business, and so that does 2 things. That system will save lives, reduce morbidity, and it will help our businesses. The wrong way is removing stay-at-home precautions too early, not having the containment apparatus in place, not being efficient in terms of the time it takes to test, to get the results, to do the contact tracing, and to isolate. And that will lead to a higher transmission rate, higher morbidity, higher mortality, more people will die. And when you get to a surge level, it would require surge level intervention, which means that you would have to shut down businesses again, and we don't want that. So when you hear people say we need balance between the economy and between the public health, that's a false choice and a false notion, because they're accepting the approach that you need to accept a certain amount of deaths in order to keep the economy humming. And it doesn't have to be that way. You can both help the economy and save lives by taking a public health approach to this in a way that I just described. So the questions that we have is, do we have, how long does it take for somebody to get tested? What are the testing methodology we're going to employ in schools, in high-risk businesses, in the general public, in our hospitals, in targeted locations, how many contact tracers we have based on our caseload and our demographics and our risk. Mind you, it takes about 4 hours for a contact tracer to fully do a good interview of an individual to assess who have they come in contact with, and then to call them up. So what is that turnaround time between getting the results and doing the contact tracing? Do we have enough shelters or locations that, and how many does the community know about them? Are they being implemented? How many are using them? And what is the turnaround time to get that individual into that support unit? Massachusetts has contact tracers, resource managers, and case managers working in the team in the community to help individuals to stay isolated. We don't have case managers or resource managers complementing our contact tracers. And so how many rooms do we have available? Where are the shelters? How long does it take from wanting to get a test to being quarantined away from family? Those are the performance metrics that we should be asking in order to determine if we have a sufficient containment system that will help us keep our businesses open and everybody safe and healthy. So when we look at this, our goal, Josh, and it is possible to open our businesses, it is possible to open our schools, it is possible to contain this virus at a very minimal level with the highest precautions for our highest risk, wearing masks, doing physical distancing, creating the plexiglass barriers where we need to. It is possible, but that would require having those elements. That would also require enforcement and messaging and a common belief amongst the society that we will do our part with social responsibility to protect others by keeping our distance with courtesy and wearing our mask with love for our neighbors and doing the right things. But until we get there, then we're going to have to take either surgical precision decisions when we're in a containment phase, or have to use a shotgun approach when you start to see our hospitals overwhelmed and over capacity, and when you start to say an out of control rate. We do not have this virus under control. It's here in the county and in the state. Just because it's leveling doesn't mean we have it under control, okay? Under control means that we're at the bottom of the transmission curve, or at least the bottom third of a transmission curve. Having it under control doesn't mean keeping it level in the fifth gear where the rates are still humming and you're still seeing infection rate, positivity rates that are above all the safety thresholds. So I think that my hope is that the more people will understand that in order to help the economy, we must take a public health approach in order to keep our businesses open and to keep confidence in our economy. And the more people understand what it takes during a pandemic, the more they can see through talking points, they can self-interpret the information and not accept data that's being used to give people false reassurances. And so this is a time where we need to do it because this summer we need to bring it down because what's coming in the fall is going to be brutal, because on top of the coronavirus, you're going to have the flu, bronchitis, pneumonias, and all the other seasonal illnesses that come in the fall and the winter. So we're going to have to start preparing for that. Also, give our nurses and doctors some rest time to prepare for a very busy fall, winter season. So this is the time that we must do everything that we can to bring those numbers down, not only the positivity rate, but also at a lower acceptable level than they are now throughout the state. Otherwise, I'm afraid that in a surge overcapacity situation that they're going to take a shotgun approach and create policy that's going to intend to decrease the frequency and the density of public gatherings. And so if we want to keep our businesses open and build resiliency in our businesses, if we want to build confidence in our economy, if we want to make sure that we have this resiliency so we're not teetering with opening, and closing, and we save lives, then this is the time to prepare and do everything we can to follow all the precautions and to convince people to follow them even in their homes when they're visiting other people's homes.
All right, thank you, Congressman Ruiz. It is 12:04 p.m., so to honor my commitment to you to keep this timely, did you want to quickly say any closing comments to our guest?
Yes. If you're having any difficulties with PPPs or the Small Business Administration loans, please don't hesitate to call my office. We were successful in advocating for opening the Small Business Administration satellite office, which has been very instrumental here in the Coachella Valley. It's the only small business office in the entire Inland Empire, and it's been proven to have helped so many businesses in the area. We have a strong working relationship with them as well. We've done multiple roundtables, conversations, town halls with the business communities and others. My initial attention was to help problem solve within our hospitals and our healthcare systems, because my number one priority is to save lives. And so I am a big supporter of small businesses, and particularly to help build the resilience that we need and the precautions to keep your business doors open, to provide the resources to help the American families have purchasing power to continue to be clients in your stores, and to build the infrastructure through resources and policies so that we can recover from this pandemic, which is not going to snap back. It's going to take some time, but we can get it done, and we're going to get it done. So I appreciate everybody's attention to this matter. And if you have any further questions, please reach out to me or any one of my staff, and we'll get back to you as an individual or as a group or as a chamber, and consider us partners in making sure that we get this under control.
We appreciate it. There were a lot of questions that we weren't able to get to, questions about the census, net neutrality, a lot of things. So if you have questions that were submitted, we will submit them to the Congressman's office. You can also call the field office directly. The phone number is 760-424-8888. And hopefully, Congressman, we can do this again in the future. We really appreciate your time today. We just want to let everyone know, thank you for joining us. The call will now be ended.